there's a huge sense of loss of I'm not taking care of anyone anymore. And what am I going to do to fulfill this need? This is just our meat suit. Spiritually, this isn't who we are. If you stay in your comfort zone, you're never going to fulfill your Dharma. And you're going to keep repeating the same things over and over again.
Change isn't just coming, it's here, faster and more intense than ever. How will you adapt when technology shifts the ground beneath our feet? I'm David.
And I'm his brother Phil. And this is Whiplash Nation, where we explore the stories of people who've mastered the art of adaptation. Welcome back to Whiplash Nation. For me, our guest today, Debbie Vojik, started off as my yoga teacher, an exceptional yoga teacher. I had no idea that she had a whole medical background.
Wait, you're telling me that you followed a yoga instructor around Baltimore like a sweaty groupie?
Guilty. But listen, I found out how deep that medical background was. She was a pediatric nurse. She was an ICU nurse. She was a clinical educator. She even ran an entire medical department, Dave.
Which is what today's episode is about. You know, we were always talking about career change. Debbie went from a traditional medical field into an entirely new area of healing.
And also, a quick heads up, we're going to talk today about Dharma.
Is that the breakfast cereal Dharma, or what is that?
It's about how we all have a life path, a calling, if you will.
But this isn't just a yoga story. It starts with burnout, winds through grief, a studio fire, and somewhere after losing it all, Debbie finds what so many of us are still looking for. She finds a way to start over again.
Dave, are you ready for some philosophic downward dog?
I'm ready for the downward dog. I just, the thing is, maybe I should stretch a little bit. I'm not as flexible as I used to be.
All right, let's go.
Let's do it.
Debbie, welcome to the show. It's great to have you here.
Thank you, Phil and David, for having me. I appreciate the offer.
We start at the beginning, because you've been a nurse for 15, 20 years now?
Actually, I've been a nurse for 33 years. I graduated from my nursing undergraduate program, and that was at University of Maryland. And I went directly into practicing from there. I was working in pediatric and neonatal intensive care. And at the time, I was very, very interested in everything in maternal child health, and I wasn't really quite sure where that was going to take me. So I gave myself the opportunity, and whenever an opportunity would arise to be trained in a different area of maternal child health, I would jump at it. So I've done labor and delivery, I've done postpartum, I've done high-risk antepartum, I worked in NICU, I worked in PICU, I worked in newborn nursery, I worked in general peds. So everything pretty much in maternal child health I've worked in. And then going back for the clinical specialist degree, perinatal clinical nurse specialist. So I was a clinical educator for a period of time as well.
I'm always curious how people got into their first careers. Was it what you wanted to do? And if you were asked as a kindergartner, for example, what do you want to do? When did you know you wanted to get into that career?
Interestingly enough, my mom worked at a hospital. She wasn't a nurse, but I was exposed to the environment pretty early on because we would go and visit her while she was at work. And at that point in time, that was probably in mid-70s. Nurses were still wearing caps and, the white dresses and white shoes, and everything was very prim and proper. And I was kind of fascinated by it. And then whenever I would have a conversation with my mom about, do the nurses like their job? It looks like it's very rewarding. And this is like a 9 or an 11-year-old person having this conversation. And, she would well, they don't treat the nurses that great,
And I have to go into that career.
And that was always, I would come back. I think that I want to do something like this. That was a response that my mom would always give me, is that they don't treat the nurses that great. It's a lot of task heavy work, and there's not a lot of reward that you get from it, from your colleagues. The reward you get is from the patients and their families. You do it because you have a general calling to help people. Inherently, that's what it was for me, because I tried other things and I was just like, this isn't working, and went to school and got, other degrees and educational backgrounds before I went to do the nursing degree. And I just was like, this isn't for me. This isn't the path I'm supposed to be on. And, I personally believe that every person is on a path, and it's something that has been driven even further home for me, getting the education in yogic philosophy, because everybody has a dharmic path that they're supposed to fulfill, so that they can evolve to a higher level of consciousness. That's what yoga philosophy says. And choosing nursing at that point in time in my life was the path that I was supposed to step onto in order to get me to where I am now. And it's been a constant evolution.
Yeah, and you have your own business now,
Yes.
and you're not a practicing nurse in the traditional sense that in a hospital clinical setting.
Mm-hmm.
Was there a moment in time, sometimes people have the change that happens over years and over time, but sometimes people have a trigger moment, someone says something.
Mm-hmm.
What was the transition from you when you said, I want to move into a different line of work?
It was kind of like moving away from the bedside and moving into more of an educator role was what I did. I had moved and worked at Mount Washington Pediatric Hospital and was doing a lot more clinical education for the nurses that work there and also for the parents before the babies or the children would get discharged home. Over a period of time, when you work with a certain patient population that could show up as underserved, there's a lot of expectation, and sometimes you can get burnt out very easily because the individuals that you're trying to help do really require so much support.
It's like compassion fatigue, right?
Yes, exactly. And I'm a very empathetic person, and that's something that I've really had to rein in with doing yoga therapy, and we'll talk about that when we get to that point. But, having all of that empathy and wanting to provide as much support as you possibly can and knowing that realistically there's no way that you can, and ultimately recognizing and seeing failure that ensues due to lack of support and structure, seeing the readmissions, seeing the frustration of the parents, and it really played on me after a period of time, and I had an opportunity to learn something new that was still in nursing but not at the bedside. And it wasn't even a lateral move. It was a backwards move for me. But it was an opportunity to learn something new in the profession that would allow me to still maintain a certain level of clinical expertise while not having to deal directly with patients and families. So I moved out of the bedside clinician, clinical educator role into working for a managed care organization. I did that for like 2 years, and then I got promoted to manager. And then I was responsible for managing about 25 clinical people and about 50 non-clinical people. And I did that pretty much full time until 2011. I met Phil probably around 2011, around that time, because that's when I went to teach at Bikram Yoga in Hamden. Before that, I had been teaching at Bikram Yoga Baltimore, because at the same time that I switched out of my bedside nursing thing, there's a huge sense of loss of I'm not taking care of anyone anymore. And what am I going to do to fulfill this need? I started practicing the Bikram Yoga series around 2004.
This is you as a customer. You're going to...
Yes. And
People that don't know Bikram, it's 26 poses and 2 breathing exercises.
yeah, and the room's 105 degrees and around 40% humidity. And I had been practicing regular yoga for a while before that, and I've been teaching group fitness classes. But when I went and practiced this yoga, it was kind of like life-changing, because I had sustained an injury that wouldn't allow me to do a lot of upper body weight bearing. So vinyasa kind of went out of the picture. And the Bikram series is very healing and very holistic and therapeutic. And I felt myself healing, not only physically, but also emotionally and energetically while I was in there. And I was like, wow, this is making a huge difference for me. I think that maybe I should consider teaching this. And the people that owned the studio that I taught at that time, it had recently transitioned from one person managing it to 2 other individuals. And one of the individuals suggested, he's like, you should go. So in spring of 2006, I went to the Bikram Yoga teacher training in Los Angeles, California for 9 weeks. When I came back, I worked full time and I taught part time from 2006 until 2012, when I opened my studio, when I worked full time at my studio and worked full time at my insurance job. So for about 5 years after I opened the studio, I was working 2 full-time jobs.
Dave mentioned something before.
Mhm.
Is there a person or a moment that led you in a transition? You said you got away from the bedside.
Mhm. I had a huge life-changing event in 2004 for me. My grandmother, who I had taken care of for a really long time, passed away, and a relationship that I was in ended. Everything that I had that I was taking care of, that I had to maintain, kind of like fell away all at once. And all there was Debbie and the job that she was doing. There was no caregiving being given anywhere, right? I think at that point in time was when I recognized that even if I wasn't at the bedside, I was still caring for something or someone, right? And then when all of that went away and I didn't have that anymore, there was this big emptiness.
Yeah.
And it was like, what's going to fill this? Artistically, when we look at what's the artist's way, what's going to fill your cup back up to make you feel creative and full and vibrant and living. And there was definitely something missing for me. When I started practicing this yoga, the practice itself started to fill me up, right? Okay. Because I became part of a community, which was huge. And you become part of this community that is its own little organic microcosm.
Yeah.
Can't even explain it. Right. And it takes on a life of its own. And you look forward to being in this community and being around the people that are like-minded. And that's when I knew, like from there, I was like, okay, this is obviously the sign. This is the next step on the path for me. And at that period in time, I really knew nothing about yoga other than I was doing it for fitness and because it made me feel better. I didn't know anything about the philosophy. I didn't know anything about any of that. I just was like, I'm doing yacht yoga. It makes me feel good. And I feel like I'm part of something.
Earlier, you mentioned a path in life that people take,
Uh-huh.
and you had a term for it, and it was a philosophy inside yoga.
Dharma, a lot of people have heard of the Bhagavad Gita, that book, right? Okay. Or the Gita. And the Gita itself is actually a metaphor for finding what your Dharma is. What is your path?
Okay.
So what is your path? When you choose your path or when you walk your path, it's not always easy, right? Because there's choices that you have to make and they're not always easy choices. And there are things that you're attached to that you have to let go of. And there are things that you're afraid of that you have to confront. And so it's not always easy to walk the Dharmic path. So a lot of times it's easier to just say, no, I'll just stay where I am because I'm comfortable here.
Yeah.
Right? You have to be willing to step out of your comfort zone to realize what is available for you. And if you stay in your comfort zone, you're never going to fulfill your Dharma. And you're going to keep repeating the same things over and over again. This is yogic philosophy in a nutshell, okay? Because you keep going back into the same grooves and doing the same things over and over again because you haven't stepped out of that groove because that's your comfort zone.
So
And until you can get out of the groove and get out of your comfort zone, you're not going to be able to utilize the wisdom that you gained in order to move.
So do you think that's a common thing? People feel, quotes we hear, I feel stuck. I feel like I'm in a rut. Those are all things we've either said or heard.
Mhm.
People being stuck in their Dharma. Like,
Yeah, and it's not, you don't get stuck in your Dharma. Your Dharma is your path. You get
Dharma
stuck in
path,
some,
yes.
you get stuck in samskaras.
yeah.
Samskaras, and you can Google all this stuff when we get done.
Yeah.
But in yogic philosophy, the intention in yogic philosophy is as we evolve. We are not, this is just our meat suit. This isn't who we are, right? Okay. Spiritually, this isn't who we are. Our soul, our higher level of consciousness is what we ascend to, right? We identify with this as us because that's ego related.
Yeah.
Right? Okay, that's ego related. But who is it that's watching this? My true self, my true nature. Okay, this is the little me, but my big me is the watcher, the witness.
Yeah.
So in yoga, you develop the witness level of consciousness, being able to step outside of this and recognize who you truly are. And when you can step just let me finish this statement and then you can ask me whatever you want.
that's fun.
And once you step out of once you're able to step out of that ego level of consciousness or that ego driven thought process, because that's what keeps you in the grooves, right? Because the ego, regardless of what you think, okay, wants you to fail. Okay. So it's going to always hold you back. It's going to always hold you back, right? Because what does it, you can't do that. You're not good enough. You can't do that. You're not good enough. Oh, yes, I am. I'm stepping out. I'm stepping out of my comfort zone. I'm moving forward. Okay. And if you constantly let your ego hold you back, you will never achieve anything.
You said that one of the things that had moved you out of the full-time practicing on the nursing side was stepping away from the bedside, be a little detached. In a way, is there a rut there? You had found your path, but you had gone away from it.
I don't think it's that. You have to kind of frame it a little bit differently.
Yeah.
Yes, there was a certain level of burnout that I had achieved by that period of time, because I had already been in nursing for like 10 years. I love what I do, and I love what I'm able to do, and I love the education that I have. Is there a way that I can apply this differently? Right? So because a different opportunity presented itself, and they were willing to train me to do something new, still in nursing, right? But not doing hands-on stuff. It's like, okay, well, this is me stepping out of my comfort zone because I know absolutely nothing about this, right? But they're going to teach me something new. And anything new that I can learn is something that I can take with me on my path.
Amazing.
The theme of this show is about change. That's what we're talking to you, because I really love that the yogic philosophy, it's built in that you are evolving.
Right.
We on this show a lot, we talk about people, they get out of college, they know a couple people, they get a job, and then they wake up 10 years later.
You know what you know. And sometimes you know what you don't know, but there's things you don't even know that you don't know. With the science of yoga, a lot of people that come to yoga, they come to it because, their doctor recommended it. You should do yoga. You have high blood pressure. You should do this. You should do that, right? Should, judge. Yeah, yoga is a great way to get physical fitness, but there's something else to it, okay? And most places that you practice don't even venture into that realm. They don't even go there. For a lot of places that teach yoga, that's what it's about. The physical practice of yoga asana postures.
It's the getting the meat suit healthy, as you said.
Exactly. When we circle back and we talk about yogic philosophy, yogic anatomy in the koshas, they all pervade one another. So there's the physical body, the energetic body, the psycho-emotional body, the wisdom body, and the bliss body. And they all pervade each other.
Yeah.
This food body, the meat suit, the Annamaya kosha, everything manifests in the physical body. Everything that manifests in the physical body is usually a precursor to something that's going wrong. Are you making the right choices? Is there a dysfunction or an imbalance in your wisdom body? Is that affecting your psycho-emotional body and your ability to make good choices? And how is that affecting you energetically?
Yeah. It's interesting, like finding your path is a big point of the reason to come here. Dharma, if someone's feeling in the rut, maybe they're not practicing yoga right now and they don't understand the philosophy, but there's some words of wisdoms in there in terms of like, if you feel stuck in a cycle or stuck in a rut, like there a shorthand you could say other than come join some Bikram, is there a shorthand for
it doesn't necessarily,
you should start with?
I understand what you're talking about, David. And it's not even about, it's not about somebody said, oh, I'm stuck in a rut. You should come and do yoga. Well, yeah, you can come and do postural yoga, and that's fine. But here's the thing. There's nothing in your life that's not yoga. A lot of people just equate yoga to yoga asana, okay? But yoga can touch every aspect of your life, okay? So when we look at yoga asana, it's only one part of the Eightfold Path, okay?
Those are just the postures.
The asanas, that's it, right? So the Eightfold Path, yamas, niyamas, asana, pranayama, dhyana, dharana.
Sure.
Okay, pratyahara and samadhi. Okay, there's an Eightfold Path, the Ashtanga, right? Okay. And within each one of those individual silos, you can create applications for every aspect of your life. Okay. But people don't tend to think about that when they come to a practice of physical yoga. However, what happens when you start to do control of the breath and recognize and be mindful about how you're moving your body through space, there's something energetically that changes.
Excellent. Yeah.
Okay. There's something very, very critical that changes energetically when you start to move the breath effectively. And it also has a very distinct effect on the autonomic nervous system in terms of sympathetic and parasympathetic and how you process information internally, physically, at an autonomic level in your nervous system.
It's amazing. Yeah, it's a lesson for all of us, how to move forward and to step out of our comfort zone. That's another thing you said a few times I think is great. A lot of people love the idea of nursing because you can be a travel nurse. There's the shortage of nurses. You can go, there's a lot of it. There's two things that I want to touch on. The first is, and for a lot of our listeners, if people are going to make changes, some people are going to move out of working in a traditional office job because they're just going away for a lot of people. And then where do they go? And they haven't been entrepreneurs. So you went from a system where you're working in a hospital, you have a boss, maybe you supervise when you became a manager, but you're in a system, it's a structure. Now you are the structure.
So it can be very daunting, right? But again, you have to step out of your comfort zone, right? So, when I decided that I was going to open a yoga studio, and I was like, how much, this is going to be so expensive, and this is going to be this, and this is going to be that. And how am I going to do this? One of the things that I've done I'll be eternally grateful for is doing work with Landmark Education and actually doing a training called Team Management and Leadership. Because you can't do this without a team. You have to have a team around you. You have to build your team and make sure that the players are on the same page. So for me, obviously, initially when I first opened, the person who managed the studio in Hamden, Sarah and her husband, they were really instrumental in giving me guidance and kind of just letting me know how this is what you can expect. This is what you can expect, right? And I think that that's really critical when you're starting out, that you find somebody that you can depend on as a mentor, because stepping out of your comfort zone is really confrontational. And if you don't have somebody that you can call up and say, this is happening and I'm freaking out and I don't, having that touchstone, that's somebody that's going to say, yeah, that's going to happen. And you just kind of have to roll through it, So honestly, for me, Sarah and Henry, Sarah mostly, she was really, really instrumental, especially in the first year while I was open, because if I had questions about the booking software or this or that or whatever, she was a phone call away, and she was just really very helpful. And, the first 5 years that you're in business, I was working full time. I was working a 40-hour work week. I had switched from being a manager because that was just too much, and parsed myself back down to just being a worker bee, because then I could work as long as I got my hours in. It wasn't like I had to be at a 9 to 5. So as long as I could get my 40 hours in a week, it was good. And that kind of opened it up for me to be able to teach a lot more. So I was teaching 10 or 12 classes a week, working 40 hours and helping to take care of my dad, helping to take care of my uncle. I guess it was probably around, actually, I worked full time for 3 years, and then I went part time, because that's when I went back to school to get the master's in yoga therapy. So I was working part time, running the studio, going to school to get the master's in yoga therapy. Finished the master's in yoga therapy in 2017. And I was still working part time, running the studio. My mother-in-law had passed away. My father-in-law moved in with us. He had dementia. I was taking care of him. So the universe doesn't give you more than you can handle. But you, as a yogic entity, have to recognize and use your wisdom to know what's too much.
Yeah.
And at that point in time, that's when I said, something's got to give. I can't do all these things and do them effectively and well, because I'm spread too thin. I'm here, right? Felt like a ping pong ball. And so I just said, you know what? I'm taking the leap. I'm quitting my job. I'm quitting my job. I'm going to do 100% yoga studio, commit myself 100% to my yoga therapy practice, yoga studio. And it was the best thing I ever did.
Amazing. All right. So the business is running. You get it going great. It's early 2020. You're doing
It is.
in-person business.
What happened? What happened then?
What happened in 2020 that
So I guess it was probably it was like March, 11th, 2020. I went to yoga in the morning, and my colleague in our yoga teacher training programs called me because we were in the midst of our first 300-hour teacher training program. She called me and she's like, they're going to shut everything down. And I'm like, what? She's like, everything's got to shut down. And I'm like, what? She's like, you can't open the studio later. Just shut it down.
money?
She's like, they're shutting everything down for a week. At that point in time, it was a week, right? I think it was a week or 14 days.
Yeah.
It was like the first thing, right?
14 days to stop the
And I
spread.
was like, yeah. And I was like, okay, we have to figure out how we're going to pivot so that we can offer stuff virtually. And at that time, no one had heard of Zoom. No one had heard of Zoom, right? Okay. One of the teachers that was teaching for me at the time, David Morley, runs a video company, Zinnia Films. And he does a lot of his meetings virtually. And he's like, we have this platform, Zoom. We'll just switch to Zoom. So him and Lauren, David and Lauren, took that ball and ran with it. And in 2 hours, everything was switched over to virtual for the rest of the rest of the 2 weeks. And, the emails were going out to everybody, and this is how you log in, and da-da-da-da-da. And in the first week, the teachers still went into the studio and we taught from the studio because they hadn't shut down everything 100%. By the end of the first week, you couldn't even go in there. They didn't want anybody to go out and go in anywhere. So then we had to do everything virtually from home. And we did that for 3 months and within, I guess, probably within the first 30 days of the pandemic, we lost about 50% of our membership. Yes, it was devastating and heartbreaking, especially when you finally just get yourself to a point where you're able to pay yourself a livable wage doing what you love. And then all of a sudden it gets pulled out from underneath of you and you're like, what now? And none of the expense goes away. You still have to pay your rent. You still have to pay your utilities. I didn't get any rent abatement from my landlord. I had to pay my rent while we were closed. Yeah.
Crazy. So how long? So that proceeded until we got out of the pandemic.
It was 3 months. We were closed for 90 days. 90 days, the studio doors were closed. And then Baltimore County said you can open back up, blah, 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 blah. And so you can open back up with 50% of your capacity. So usually I would put 40 people in the hot room. So I was like, okay, well, that's 20. And in order to put 6 feet around each person so they feel comfortable, that's 15. So when we opened back up, we were only having 15 people per class in the hot room space, which is almost 2,000 square feet. And in the blue room, 5.
So that's still even bigger. Did you still offer Zoom for people that didn't want to come in so they could?
Oh, no. It got really, we did that for about 9 months after we reopened, doing virtual and the live, right? And it gets to be really tedious for the teacher to manage that at the same time as trying to manage a room, like having a live video and then managing a room and then taking into account how comfortable do people feel being on a live stream video if they're in there practicing. So we did it for about 9 months, and then slowly but surely I just kind of filtered it out. And so no, we don't do anything virtually.
When did you feel like
anymore?
You were back? Was there a moment where you're
last week?
I'm leaving another part of the story, but
no, it's funny because you came back, and then I don't want to spoil the.
We came back, and we were just getting back up. We were almost back to our pre-COVID numbers in October of end of September, beginning of October 2023, and then we had a fire in the studio. So one of our humidifiers caught on fire, and it totally it racked the hot room. We had to rebuild. We had to completely rebuild the hot room. So we had to demo the entire hot room, take everything out of there, get all the water damage from the fire mediated. Everything had to be wiped down and replaced, and just it was a mess. It was a mess. And we had to, again, when that happened, we had to pivot because it's like, okay, I can't not offer classes because I'm going to lose my membership again. And I just got back to where I was. So that happened early in the morning one day. And that evening, we took the rest of the day off because we had to like clear out the space and get the smoky smell out. And the restoration company was in putting all their equipment in and the dehumidifiers and the fans and this and that and sealing everything off so you couldn't smell the smoke from the hot room. And so the next day we moved, we have our smaller room, which is our blue room where we normally do our cool classes, which is not equipped to do hot yoga. It doesn't have the heating system for hot yoga, doesn't have the humidification system for hot yoga. And I got on phone with my HVAC guy and I'm like, I need you to fix this heating system so that I can turn it up to 105. The guy who does my HVAC is somebody that I met through Sarah, teaching at her studio, who's now a very good friend of mine. Yeah. And he's like, I'll be right over. And yes, Henry works for Vince now. Henry, who used to manage the Bikram yoga Hamden with Sarah, her husband, he works for Vince. He came over and he walked in and he was crying. He was like, I am so sorry this happened to you. Right. And, I said, Henry, everything happens for a reason. I can't let myself get hung up on the why and what have yous. Everything happens for a reason. We're just going to keep on trucking. Fix the heater in there so I can get that room to 105.
Amazing.
And he's like, I don't think we're going to get to 105 because it's a heat pump, but we'll do the best we can. So in the interim, I had to get some backup heaters in there and some portable humidifiers, and we could only fit like maximum 20 people in there for classes. But we did that from beginning of October 2023 until the second week in January of 2024, and then we opened the new hot room, and we had redone all the systems in there, all the HVAC systems, and put in new humidification, put in new heating panels in the ceiling, new lighting. So everything in there is new flooring, everything's new. So it's like a brand spanking new studio. And that's when you said, well, when did you get back to your last week? Seriously, last week, after all that, last week I hit my pre-COVID number.
Amazing. That's years later.
Yes.
We have a segment we always ask people, like, and I'm not sure, Phil, the question usually goes something like, when you started your career, what would you tell yourself back then? But I'm not sure if the question is when you started your nursing career or when you started your yoga career. I mean, and this is a choice. Maybe you could start off with, if your current self could tell your 20-year-old self, what would you tell yourself?
If you do something and you feel really strongly about it and you feel very attracted to it and drawn to it, you have to pay attention to that. You can't, because it's going to keep poking you until you address it. And if you don't address it at the end of your life, when this is getting ready to go away, right? Okay, you're going to have a regret, and the regret leaves you in that groove, in that samskara. And guess what? If you don't fulfill it this time around, you have to come back again and deal with it again. You have to follow your intuition. If there's something that's poking you and just saying, you got to do this, you got to do this. Did I have to do everything that I did? I could have just opened a yoga studio and just said, okay, I'm just going to teach yoga asana. But for me, it just was like, this isn't enough because I don't know enough. And in order for me to guide people, I have to be an expert, which was the precursor to going back to get the master's in yoga therapy. Being a yoga therapist was never part of the equation, right? It was me going back to school to learn more about yoga. But in the interim, I became a yoga therapist. So then I had a yoga therapy practice. And I see people and I treat people using yoga as therapy. And while working in that realm, after being poked to do that, right? Okay. The next thing that poked me was these people that I'm seeing don't have anybody managing them primarily. And when I'm working with them and I'm recognizing that there's things that I need in order to further my plan of care in order to treat them, and I reach out to their primary doctors, their doctors are like, who are you? And that's when I said, you know what? I'll do it myself. So that's when I went back to school again. And I finished in 11 days.
You'll be an NP, a nurse practitioner?
Well, I'll have my advanced practice nursing degree, and then I have to take the boards, and then I'll be a nurse practitioner.
You will be the doctor.
I will. I'll be the nurse practitioner. Don't call me a doctor.
Okay, yeah.
I'm always a nurse. I've never not been a nurse.
Philosophy.
You have to have critical thinking skills. You have to be able to look at a situation and assess it. What are you going to do first? What are you going to do first? What takes the most priority? My nursing lens always tells me that. What am I going to do first? And I can apply it in any aspect of life. It doesn't have to be medical, because you learn the nursing process when you go to nursing school. Okay? You utilize it day in, day out, regardless of what it is that you're doing. Assessment. Okay? What am I seeing? What am I taking in? What's the problem? What's the plan? What am I going to do about this? Okay? What's the intervention? What did I do?
You have to see the whole situation. So what's the next right thing to do? Which is what we all have to do if we have to make a change. What's the next thing I need to do for the change? But
Right.
yeah,
Or break it down into a series of things.
Yeah. Mhm.
smaller parts.
And it's just all about critical thinking.
Well, I just want to thank you so much, Debbie, for being here.
Thank you.
We get to talk to people. I feel this is like a therapy session more than it was a podcast for me personally.
Me too. Like I learned so much, like the whole thing about finding your path and Dharma. I've got it all written down. I got a lot of Googling to do after this.
So thank you so much for being here, for taking the time to talk with Dave and I.
Thank you so
If
much.
you ever just want to have a conversation about Dharma, we can do that too.
Next time I'm down in your area, I'll come and take a class.
Sounds like a plan. That's awesome.
Awesome.
All right.
Thank you.
Well, have a good day, guys.
That was fun.